Just to remind everyone that the Horizon study is a completed and now analyzed trial in relapsed refractory myeloma in which all the patients had to have had prior pomalidomide and a CD38 targeting antibody or both. And so, in fact, was enriched for patients who were triple class resistant in over almost 160 patients treated at multiple centers, both in the United States and Europe. So a multi-center international trial, single-arm phase 2 study in highly resistant patients who are relapsed and refractory and in themselves constitute an unmet medical need. Now, in that population, we were enriched for patients who were, had extramedullary disease, which is particularly ominous prognostically, as well as other high-risk features, and importantly, the feature of being triple-class refractory. Now, just to remind everyone, Melflufen is a novel peptide-drug conjugate, and how it works is by being targeted by so-called aminopeptidases, which are enriched in myeloma versus normal tissue. And by so doing, the Melflufen is able, in its highly lipophilic form, to be delivered close to the tumor and in a targeted fashion entrapped within the tumor. And so it's highly selective. By virtue of that, it does not cause mucositis, it does not cause hair loss, for example, but most importantly, it delivers the alkylator warhead, in this case melphalan, directly to the tumor. So with that in mind, we were very pleased to see that about a third of patients responded to Melflufen therapy overall. And at this meeting, we've drilled down on specific subgroups. Importantly, we've drilled down on the extramedullary group. This is a group of patients where we know that in the relapsed refractory setting, once extramedullary disease occurs, it's particularly ominous, and the prognosis is generally awful. We're very pleased to see that in this group of patients, 24% of them responded, and in those who had significant responses, there was durability of disease control, and this was particularly striking. So it's an exciting result for the extramedullary disease population. We then also looked at patients with high-risk cytogenetics, and we're able to see similarly that there was a consistent response rate in that group of patients. These are patients with 1q amplification and 17p deletion. And finally, we were able to look at a variety of other features, including quality of life and hospitalizations and so forth. We're able to demonstrate that in the Horizon trial, the performance of the drug, it's a once-a-month infusion with dexamethasone given weekly. It was remarkably well-tolerated overall, recognizing that the most important side effects include thrombocytopenia, neutropenia, and anemia. And these did prove manageable with appropriate supportive care, and rates of significant infection and bleeding were extremely low. So that was actually very encouraging to see in such a high-risk group. Finally, we did a pooled analysis, not only of patients in Horizon, but patients in another trial called 012M, where we had originally done the phase 1-2 work of Melflufen in relapsed refractory disease. And we looked in both groups at the alkylator-exposed patients, in other words, those patients who could be considered appropriately alkylator resistant. And we were very encouraged to see there that the drug is able to work, is able to engender responses in a significant number of patients, again, about 20-25% overall for those who've been exposed to prior alkylation. And if they've only had one or more prior alkylators, the response rate was around 30%. But if they're really truly refractory and have multiply been exposed to alkylators, the response rate is substantially lower, but not unexpectedly perhaps. But again, it brings to bear the question that, if we can successfully introduce Melflufen, which we're very hopeful will be the case, it will become a preferred targeted approach with a cytotoxic agent by virtue of all these encouraging features.